Well, ever since Bill 11 passed in Alberta, there has been constant controversy over the changes being put into place in our healthcare system. So joining us to chat about this is Justin Wright, Minister of Primary and Preventative Health Services and MLA for Cypress Medicine Hat. Justin, good to have you with us today.
Good to be with you, and thank you so much for having me.
All right. So, Minister Wright, before we dive into the controversy over the dual practice model, can you maybe tell us a bit about primary care networks? What are they and how do they function?
Well, primary care networks are ultimately a go-between between our primary care practitioners and our patients that are in our communities. They're a way that people can work together to be able to get people connected with primary care practitioners. You know, I look at the Palliser Primary Care Network in my own city of Medicine Hat. They're remarkable. They've got a stat that is just phenomenal, which is 94.5% of the people within the catchment area of the PCN are actually already connected to a primary care practitioner. And this is a huge win from just a couple of years ago. It shows that when we work together to find common ground to get people the primary care they need, that these programs work.
Okay. I understand that Alberta will be implementing regional primary care corridors. So each corridor will have more localized PCNs or primary care networks. So what difference does this make?
Yeah, they kind of act as a regional oversight. They make sure that the PCNs are being supported, that they're being helped out. In the past, we have had some PCNs that have struggled. This gives an added avenue for folks to be able to go along, support, hold accountable if need be, but more importantly, supports our PCNs in the important work they do to make sure that Albertans are getting connected to primary care practitioners.
Okay. And apparently the Palliser Primary Care Network, which is where your riding is one of the top performers in the country. So what are they doing differently? What can we learn from this?
Well, that's actually what I've been spending a lot of time doing. I've been very fortunate enough to connect with them on a fairly regular basis to be able to find out some of their best practices that we can implement across the province. And from that, what we've found is that there's actually about 80% of the items that PCNs are responsible for that could be standardized to make sure that the same practices, same processes are being practiced clear across the province, while still leaving about 20% of the unique autonomy to regional or area specific requirements. A lot of it comes down to the relationship that they've built with the practitioners in the area. The folks in the Palliser region have specifically been able to really make a lot of inroads, showing how they can support, be able to find some administrative solutions to be able to provide additional services for family clinics, to be able to get them additional coverage, where the physicians can focus on patient needs and the Palliser PCN is able to do a lot of administrative work to take that burden off the practitioners.
Mm-hmm. There continues to be criticism over Bill 11 and the dual practice model. Some say that it violates the Canada Health Act. Does it?
No, it doesn't. Our focus continues to be 100% of backing up our public health guarantee, making sure that any medically supported and medically needed procedure is going to be taken care of with priority one. It is always going to be that way. This is just giving avenue for physicians to be able to operate at their full capacity, as well as patients to be able to get the services they need when they need and where they need.
Mm-hmm. What kinds of surgeries will be available for Albertans to access privately?
Well, you know, when we take a look at some areas where we could see some real traction would be on our knees, hips. There's also going to be some of our ophthalmology services that would be available. This is going to clear up a backlog right across the gambit. There's no one specific area, which is why, you know, when you really sit down and look at it, there is a multitude of avenues that this is going to give us the services for. And Minister LaGrange and her team of hospital and surgical health services are really taking the lead on this one. It falls under the jurisdiction of their ministry, and they're really going to be landing on means to really shorten up those wait lists.
Okay, something else on people's minds that people are kind of worried about. Could this potentially lead to doctors prioritizing private care over public care?
No, our public health guarantee from 2023 is still in place. Our priority has been and always will be the publicly serviced healthcare first, period. End of story. There is no wiggle room on that one. We are simply delivering more choice for Albertans to be able to take control of their healthcare and maintaining the public system first and foremost.
There are always concerns, of course, voiced over becoming like the American healthcare system. So is this dual practice model a U.S. model, or is it more of a European model? And I mean, I've heard it's European.
Yeah, it's certainly built on, the best practices from around the world. There's been aspects of the Scandinavian model that's been brought into this, but there's also been some really key areas like Japan and South Korea that have actually had some influence on what this bill looks like. These are all areas that have a great public system that is prioritized first, but also has the avenue for dual practice and it be successful. They're really shining examples in Scandinavia, as well as in Japan and South Korea that we are trying to model off of and build a very successful system for Albertans.
Okay, so with the European models and the Asian models, what do the stats tell us about their success or lack of success?
Well, yeah, there's some really great numbers that are coming out of Japan and South Korea specifically. When we take a look at what the runoff affects, they're actually able to significantly reduce their wait lists on people waiting for surgeries outside of medically required or medically recommended times. And in the Scandinavian models, much the same. This is about making sure that folks are getting the health care they need in the medically recommended timelines to ensure that folks are being able to get their conditions treated in an appropriate time period to be able to go back to live healthy lives. This is about giving control back to Albertans and making sure that we are able to really focus on Albertans living to their full scope of life and what they like to do.
So if there's so many successful models in other countries like Asia and Europe, any thoughts as to why we're seeing so much opposition to the proposed changes in healthcare?
Well, I think it just comes back to, the simple process of change management. When any time there is change that comes into something that people really are passionate about, there's always the concern and fear of it being changed into something that they're not necessarily comfortable with. For us, it's again about prioritizing the public health guarantee, making sure that the publicly funded system continues to be our priority while still giving Albertans the ability to choose and have additional avenues to control their health care in the way that they feel comfortable.
There's been controversy over the province's decision to allow self-referred private diagnostic testing. So this would be things like CAT scans, MRIs, et cetera. So how would you respond to critics who argue that this will divert resources away from public clinics?
Well, I think it's important to remember that this is the evolution of a program that's existed since 2011. In 2011, the program existed under a very convoluted way of reimbursement. It needed to be physician referred to be able to get these private scans. What we're doing is we're creating a simple, straightforward way of getting reimbursed. And we are allowing Albertans the ability to work with a limited number of clinics across the province to take on these services. These services must prioritize the public health system first. And if a new diagnosis of new cancer is found, then these folks will have a very straightforward way of getting reimbursed with one form that needs to be filled out online. This is about giving more control to Albertans to be able to make decisions on their health care that they feel is best for them.
And how would you respond to the accusation that this will result in queue jumping for the wealthy?
I would say we didn't see that in the 2011 program, and we're not going to see that now. We certainly have the avenue to continue to prioritize and focus on the primary goal, which is the publicly funded healthcare system and making sure that they're prioritized first. All of the clinics that are providing these preventative health screenings are under contract to make sure that they are prioritizing those services first before any privately funded services.
Okay. How is Alberta doing in the area of recruiting more physicians?
Well, we've got more physicians than we've ever had in the province's history. This is vital to making sure that we're able to get out and make the investments in our communities. I look at our rural healthcare announcements that we've had recently, announcement agreements that we've had recently, including with communities like Bashaw, where we've actually seen 59 new healthcare practitioners be able to come into these rural remote communities to provide better services for our rural Albertans, to make sure that they're getting the healthcare closer to home and not having to always travel into some of our bigger centers.
What can Albertans expect to see next in healthcare as we head into the fall?
One of the big things that I'm focusing on right now is just making sure that our scopes of practice of our practitioners align with what the schooling they receive is. There's so many examples out there, whether it's with nurse practitioners, RNs, LPNs, optometrists, even physicians, and some of our specialists, where they're not actually able to practice to the full scope of practice that they've been trained and certified in. So what we're doing right now is we are undertaking one of the most aggressive scope reviews in the province's history to make sure that we are having more practitioners practicing to the max scope of what they have the training and certification for, to ensure that there is more healthcare professionals delivering healthcare closer to home for Albertans when and where they need it.
All right. Well, thanks so much for your time today, Minister Wright. Really appreciate it.
Thank you very much. Thanks for having me.
Justin Wright is the Alberta Minister of Primary and Preventative Health Services. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks so much for watching.